An alarming statistic out of Owensboro caught our attention. In one weekend, the area saw 5 overdoses involving teenagers. That word from a River Valley behavioral health nurse in a story we covered yesterday. And it seems to indicate a problem with our youth. So today, we invited Nikki Fair with River Valley Behavioral Health to talk to us more about this. Nikki, thank you so much for joining us. And as I just said, you know, that number was brought up in a Narcan giveaway story that you all sponsored yesterday, and we reported on it. The nurse practitioner said that there were 20 overdoses, 5 of which, she says, were youth over a weekend. Now, that really caught our attention. Do those numbers alarm you? Are they pretty typical?
No, I'd say the numbers continue to increase. When they say youth, what she was referring to is ages, 16 to 24, we consider youth, and we're seeing a larger amount in our medication-assisted treatment programs that we have here at River Valley. We're seeing a larger amount of the younger population that is already tried and is using these substances.
Okay, so that clarifies it. We're talking not just like teenagers, kids in high school, middle school, or high school. You're saying that goes into like early adulthood, into, like you said, 24 years old, correct?
Correct.
But were some of them teenagers? Are we seeing a growing problem in high school kids, younger kids?
We are. We've done education with some of the schools in our local areas in different counties because the high school age kids are trying different things, and we want to make sure that everybody's safe because unfortunately they never know what they're getting. They might be told one thing, but a lot of things, and this is what we're getting from police departments and different community resources, that a lot of different things are laced with fentanyl now, and people are not aware that fentanyl is in them, and that's why we want to make sure we have Narcan available to the community to help with this.
Well, let's talk about the Narcan then, because as I understand it and what the nurse told us yesterday was that Narcan was used in those weekend overdoses and kind of corrected it. Is that right?
That's our understanding. We were told that there was 5 overdoses and that Narcan was administered to all 5 individuals.
Yeah. And yesterday was a Narcan giveaway where you give it away to anyone who asks for it free of charge. You mentioned that it's so important that people don't lose their lives at this. But, those giveaways sometimes run into criticism from people who say they just promote drug use. What is your response to that?
I'm sorry, you cut out just a little bit. If you could repeat that question.
I sure can, yeah. The Narcan giveaways, they sometimes get criticism from people who say they promote drug use, they promote it. What's your response to that?
So we're not promoting drug use. We're promoting saving people. So the people that typically come to the Narcan is not always those that have addiction. It's the family members and the loved ones of those that have people that are currently in recovery or that they're trying to help through the recovery process. It's also individuals that work with students, kids, college-age kids. They want to have Narcan on hand because you don't know what's going to occur. And again, like I said, they don't know what they're getting. It's not always what they think they are going to take. So it's not safe either way. But and we also want it to be in the hands of those that are having chronic pain management and they have pain medications at home. And if you have children or anything in the house, it's always good to have Narcan available if you have any kind of opioids.
Because it could get into the wrong hands very easily. That's very true. Now, we only have a few seconds left here, and I know this is a big question, but I have to ask you, other than Narcan, what do we need to be doing to help folks who use drugs, who abuse drugs, are in jeopardy of overdosing? What more do we do other than Narcan?
So what we do, River Valley continues to grow and build programs to support the community. And so we've got medication-assisted treatment. We're definitely not the only one in the area, but we have inpatient, we have outpatient, we have therapy. So there is a lot of solutions to help people get the support they need so that they're not in the addiction process. And we're always available to help help anybody find that help that they need.
And they have to stay alive to get that help, and that's where the Narcan comes in. All right. Nikki Fair with River Valley Behavioral Health, thank you for all that you do to combat this problem in our area, and we wish you success in that. Thank you so much for joining us today.
Thank you.